I'm Amanda Bowman.
I'm Ashley Love.
I'm Alexis Kone.
This is our extra credit bone video along with muscles for the Bio 2630 Anatomy and Physiology class. There are 4 sutures in the skull. This is the coronal suture. This is the sagittal suture. This is the lambdoid suture, and this is the squamous suture. So this is the frontal bone in this area. This is the glabella, the supraorbital foramen, occipital foramen, and notch. This is the occipital bone. This is the external occipital crest and protuberance. This is the foramen magnum. These are the occipital condyles. The hypoglossal canal is inside the foramen magnum, and the jugular foramen sphenoid bone, the greater wings, the lesser wings. The hypophyseal canal or fossa, the anterior clinoid processes, the posterior clinoid process, optic foramen canal, the superior orbital fissure, the foramen rotundum, foramen ovale, foramen spinosum, here, the foramen lacerum, pterygoid processes, here. This is the ethmoid bone. This is the orbital plate, the perpendicular plate, the crista galli, the cribriform plates, the middle nasal concha. This is the temporal bone. This is the squamous region, the mastoid region process, the tympanic region process, the external auditory meatus, the styloid process, the mandibular fossa is in this region here, the zygomatic process, and the carotid canal can only be seen on the skull, which is here.
This is the mandible bone. This is the body, the ramus, the mandibular condyle, the coronoid process, the mandibular notch, the mental foramen, the mandibular foramen is here, and the alveolar margin is between the teeth. Bone. Oh, sorry.
Go ahead.
This is the maxilla bone. This is the frontal process. The inferior orbital fissure is shown on the skull, which is here. The infraorbital foramen is here. And the infraorbital foramen, the alveolar margin. Okay. So these are the palatine bones. And then shown on the skull, palatine bone. These are the zygomatic bones. The left and right zygomatic bone. These are the lacrimal bones. This is the vomer. And inside the skull, the vomer is here. These are the nasal bones. And on the skull, this is the nasal bone here. This is the hyoid bone, the greater horns, and the lesser horns. In the middle ear ossicles, the malleus, the incus, and the stapes. This is the atlas, the first cervical vertebrae, the superior facets, the inferior facets, transverse foramen, transverse process, and the vertebral foramen. The second cervical vertebrae. These are the superior facets, the inferior facets, the vertebral foramen. This is the body, the spinous process, and the dens of the axis. This is the cervical vertebrae, the superior facets, the inferior facets, the transverse foramen, the transverse processes, the body, the vertebral foramen, and the spinous process.
You ready? Mm-hmm. This is a thoracic vertebrae. It looks like a giraffe. You have the superior facets, the inferior facets. You have the vertebral foramen. And over here you have the body. You have the transverse process. And then here you have the spinous process. Vertebrae. You have the superior facets, the inferior facets. You have the vertebral foramen, the interforamen, the body. Then you have the spinous process. Here is the sacrum. You have the superior articular facets. You have the medial sacral crest, the lateral. You have the sacral foramen, which are these holes. The sacral canal, which should be in here. Then you have the articular surface. And then you have the coccyx, which has 4 coxal vertebrae. Now here we have a rib. You have a head with the articular facet. Then you have a neck. You have a tubercle, which is this little notch right here. Then here's the body with the costal groove, which is this notch. This is the sternum. This is the body with the costal notches. This is the manubrium. This is the jugular notch in the center. This is the clavicular notch, which is here. Then this is the xiph process at the bottom. And this line here is the apex. The clavicle, this is the clavicle. It has 2 ends. The sternal end, the acromial end. Attaches to the acromion. This is the scapula. This is the acromion. This is the cord process. This here is the spine. This is the supraspinous fossa. This is the infraspinous fossa. This is the subscapular fossa. This is the glenoid cavity. Here is the suprascapular notch, which is here. And then you have the superior border, the lateral border, the medial border. This here is a humerus. You have the shaft, You have the deltoid process, which is this rough part here. And this the head. This the anatomical neck, the surgical neck, the greater and lesser tubercles, the intertubercle groove. This is the radial fossa, the coronoid fossa, which is here. Then you have the lateral epicondyle, the medial epicondyle. This is a capitulum, this piece here. You have the trochlea, and when you flip it to the other side, you have the olecranon fossa, which is here. This is the ulna. This is the olecranon process. This is the trochlear notch. This is the radial notch here. This is the coracoid process, coronoid process. This is the styloid process. This muscle is the frontalis, which has the origin of the occipital bone, which is in the back. The insertion is the glioaponeurosis. Its action is to wrinkle the forehead, which is, I guess, when you do this. And the nerve is the posterior auricular and temporal nerve in the facial. Occipitalis muscle, which is back here, also has an origin of the occipital bone. Its insertion is the glioaponeurosis, and its action is to pull the scalp back. Unfortunately, I cannot perform that muscle. And it also has a nerve inertion of the posterior auricular branch of the facial nerve. This is the temporalis muscle, which has an origin of the temporal line and an insertion of the the coronoid process of the mandible, which is this bone here. Its action is to retract the mandible, which will be this action. And its inertion is to the mandibular branch of the trigeminal nerve in the face. This is the auricularis muscle. It has a superior, an anterior, and a posterior side, which is not shown here in this picture. It has an origin of the cartilage auricular and an insertion of the glioaponeurosis. Its action is to pull the ear, which unfortunately I cannot show that action, and it has an inertion of the temporal branch of the facial nerve. This is the corrugator supercilii, which is the eyebrow muscle. It has an origin of the supraorbital arch and an insertion of the forehead skin, so somewhere up here. It has an action of wrinkles the forehead as well, which will be this action here. And the inertion of the supercilii muscle, is the temporal branch of the facial nerve. This is the nasalis muscle, which is across the nose. It has an origin of the frontal process of the maxilla, which the maxilla bone is in this area here. It has an inertion of the depressor septi, but its insertion is the nasal aponeurosis, and its action is to open and close the nostril muscles. This is the masseter muscle, which has an origin of the zygomatic arch. So that will be in this area here in the cheek area. It has an insertion of the lateral surface of the ramus of the mandible. So the mandible is this bone here, so it would be in this area where its insertion was. Its action is to close the jaw, so that would be closing the jaw like this, and it has a inertion of the mandibular branch of the trigeminal nerve. This is the risorius muscle, which action is to pull the corner of the lip straight back. It has an origin of the deep fascia of the face, so the deep muscles of the face is its origin. Its insertion is the modiolus of the angle of the mouth, so somewhere in here. And its action, which I already mentioned, is to pull the lip straight back. This is the buccinator muscle, which helps in mastication, which is chewing. Its inertia is the facial nerve. Its origin is the external alveolar margins, which are in the teeth, which are in the mouth. And its insertion is the descutates of the mouth. The zygomaticus nerve has a major and a minor. Its action is to pull this angle of the mouth laterally, and its inertia is a facial nerve. Its origin is the zygomatic bone, which will also be in this region, and its insertion is the skin of the upper lip, so somewhere in here. This is the orbicularis oris muscle, which action is to purse the lips, which would be the kissing action, so like this. And the origin is the inferior surface of the mandible and the maxilla. Its insertion is the corner of the lip here, which is called the margin of the lips. This is the mentalis muscle, which its insertion is the skin on the chin. Its action is also to elevate the skin on the chin. Its origin is the incisive fossa. Muscle here is the levator labii superioris. It has an origin of the medial infraorbital margins, which is in this area. Its responsibility or action is to pull the upper lip. Its insertion is the skin and muscle of the upper lip, so still in this area here. And it has an inertia of the buccal branch of a facial nerve. This muscle is the depressor labii inferioris. Its responsibility is to depress and draw back the lip. Its nerve is also a facial nerve, and its origin is the outer surface of the mandible, so down here. And its insertion is the skin of the lower lip. This muscle here is the depressor anguli oris, which has an action of pulling the lip also as well. And it has a nerve, facial nerve, as its inertia. Its origin is the outer surface of the mandible here. Its insertion is the modiolus angle, so right in here. This is the digastric muscle, which action is to help in swallowing. It lifts the neck back. Its inertia is the hyoid bone, myohyoid nerve of the facial nerve. Its origin is right at the bottom of the mastoid process, and it has an insertion of the hyoid bone, which is down here. This is the mylohyoid bone. Its nerve is the mylohyoid nerve. Its action is to elevate the hyoid bone, which is here. Its origin is the mylohyoid line, which I think is right in here. And its insertion is the body of the hyoid bone, so right in here. The stylohyoid muscle is right in this area. Its insertion is the styloid process of the temporal bone, which will be somewhere in this area. Its action is to aid in swallowing by lifting the hyoid bone back. And its nerve is the mandibular branch of the facial nerve. And it has an origin of the styloid process. hyoid muscle, which has an origin of the manubrium, which is the top part of the sternum. It has an insertion of the greater hyoid bone in here. Its nerve or inertion is the ansa cervicalis nerve, and its action is to depress the hyoid bone, which is the hyoid bone. This is the thyrohyoid bone. Its action is to elevate the larynx. It has an inertion of the C1 nerve, and its origin is the oblique of the llama, and its insertion is the inferior body of the hyoid bone. This is the sternothyroid muscle. Its innervation, which is nerve, is the cervical spinal nerves 1 through 3, and its action is to pull the thyroid cartilage inferior. It has an origin of the posterior side of the manubrium, which is here in the sternum, and its insertion is the thyroid cartilage. This is the platysma muscle, which comes down on both sides and covers most of the neck muscles, so it's superficial to the other neck muscles. Its origin is the fascia of the chest, so the tissue outside here, and its insertion is the lower margin of the manubrium, which is going to be again in the sternum. It has a inertion of the of the facial nerve, not the cervical spinal, so the facial nerves that are in here, and its action is to depress the mandible. So in this area, the mandible, as you can see, it's attached to there. This is the omohyoid muscle, which has an inferior and a superior end. Its inertion is the cervical spine nerves 1 through 3. Its action is to depress the hyoid bone, which is in here. Its origin is the superior surface of the scapula, and the scapula is going to be behind here. And its insertion is the hyoid bone, which is here. This is the sternocleidomastoid, which is the accessory nerve. Its action is to rotate the head, so this action here. And its origin is the manubrium of the sternum, which that bone will be here. And its insertion is the mastoid process of the temporal bone. Temporal bone is going to be in this area here, so it connects all the way up there. This is the scalenus muscle. It has 3 parts: the anterior, the medial, and the posterior. And its action is to elevate the first 2 ribs, so this area here. And its inertion is the cervical spinal nerves. And its origin is the transverse process of the temporal bones in this area. And its insertion are the first 2 ribs in this area. The semispinalis capitis muscle is here. It has an action of extending the head down and back. Its nerve are the spinal nerves. We're going to be down the center. Its origin is the transverse process of the lumbar vertebrae in this area, and its insertion is the spinous process of the cervical vertebrae T1 and T4.
This muscle here is the spinalis capitis. The origin is the spinous process of the vertebrae C7 through T6. The insertion is the mastoid process of the temporal bone, which is over here, and then also the occipital bone. The action is to extend and hyperextend the head, so it's like here and then hyperextending way back there. And that is with the cervical spinal nerves. This muscle is the deltoid. The origin is the acromion and the spine of the scapula, which is over here. The insertion is the deltoid tuberosity of the humerus. The action is extends and laterally rotates the arm, so it's like this. And the nerve is the axillary nerve. This muscle here is the pectoralis major. The origin is the sternal end of the clavicle, which is here. The insertion is by a short tendon into the intertubercular groove of the humerus. The action, it rotates the arm medially, so it's like that. And the nerve is the lateral and medial pectoral nerve. This muscle here is the pectoralis minor. The origin is the anterior surface of ribs 3 through 5. The insertion is the coracoid process of the scapula. The action, it draws the scapula forward and downward. And the nerve are both of the pectoral nerves. The intercostal muscles have both internal and external. The external's origin is the inferior border of the rib above. The insertion is the coracoid process of the scapula. The action is to elevate the rib cage, and it aids in inspiration, so which is breathing in. And the nerve is the intercostal nerve. And then the internal intercostals, the origin is the superior border of the rib above. The insertion is the inferior border of the rib above. The action, it depresses the rib cage, so that aids in forced expiration, so breathing out. And the nerve is the intercostal nerve as well. This muscle here is the serratus. The origin is by a series of muscles that slips from ribs 1 through 7. The insertion is the anterior surface of the vertebral scapula. The action, it abducts and raises the arm. And the nerve is the long thoracic nerve. This muscle here is the trapezius. The origin is the occipital bone, which is here. The insertion is the spine and the acromion process of the scapula. The action, it stabilizes, raises, and rotates the scapula, and the nerve is the accessory nerve. This muscle here is the levator scapulae. The origin is the transverse process. The insertion is the medial border of the scapula, which would be right around in this area. The action, it elevates and abducts the scapula, and the nerve is the cervical spinal nerve. So here is the rhomboid minor. The origin is the spinous process of C7 and T1. The insertion is the medial border of the scapula. The action, it retracts the scapula, which also aids in squaring your shoulders. And the nerve is the dorsal scapular nerve. This muscle here is the rhomboid major. The origin is the spinous process of T2 through T5. The insertion is the medial border of the scapula as well. The action, it stabilizes the scapula, and the nerve is the dorsal scapular nerve. This muscle here is called the longissimus. The origin is the transverse process of the lumbar. The insertion is the spine of the upper thoracic and cervical vertebrae. The action, it extends the vertebral column, and then the nerve are the spinal nerves, which all run through here. So this muscle here is the supraspinatus. The origin is the supraspinosus fossa of the scapula. The insertion is the superior part of the greater tubercle of the humerus, which is in the arm. The action, it stabilizes the shoulder joint, and the nerve is the subscapular nerve. This muscle here is the infraspinatus. The origin is the infraspinous fossa of the scapula. The insertion is the greater tubercle of the humerus, posterior to the supraspinatus. The action, it rotates the humerus laterally, so going this way. And the nerve is the subscapular nerve as well. There are two teres muscles. The teres minor is above the teres major. The teres major, the origin is posterior surface of the scapula at the inferior angle, which is down here. The insertion is the intertubercular groove of the humerus. The action is it medially rotates and abducts the arm. And the nerve is the lower scapular nerve, which is here, above the major. The origin is the lateral border of the dorsal scapular surface. The insertion is the greater tubercle of the humerus. The action is that it helps stabilize the shoulder joints, and the nerve is the axillary nerve. This muscle here is the subclavius. The origin is the costal cartilage of rib 1. The insertion is the groove of the inferior surface of the clavicle, so that would be under here. The action is that it stabilizes the pectoral girdle, and the nerve is the nerve to the subclavius. This muscle here is called the latissimus dorsi. The origin is via the lumbodorsal fascia in the spine. The insertion is the floor of the intertubercular groove of the humerus. The action is a powerful arm adductor, so that brings the arm out this way. And the nerve is the thoracodorsal nerve. There are two types of oblique muscles. There's the external oblique and the internal oblique, which is here. The external oblique's origin is the outer surface of the lower 8 ribs, which is down here. The insertion is the line A alba via the aponeurosis. The action is to flex the vertebral column, and the nerve is the intercostal nerve. And then we go down to the internal oblique. The origin is the lumbar fascia. The insertion is the pubic crest. The action is the same as external, so that is to flex the vertebral column. And the nerve is also the intercostal nerve. This muscle here is called the rectus abdominis. The origin is the pubic crest, which is down here. The insertion is the xiphoid process of the sternum. The action is to stabilize the pelvis during, walking activities. And the nerve is the intercostal nerve. So deep to the rectus abdominis is the transverse abdominis, which runs this way. The origin of the transverse abdominis is the inguinal ligament. The insertion is the pubic crest. The action is it compresses the abdominal contents, and the nerve is the intercostal nerve. So the triceps brachii is this muscle here. The origin is the lateral head of the humerus. The insertion is by the common tendon into the olecranon process, which is down here. The action, it stabilizes the shoulder joint, and the nerve is the radial nerve. This muscle here is the biceps brachii. The origin is the tubercle above the glenoid cavity of the scapula, which is in here. The insertion is the common tendon of the radial tuberosity. The action is a weak flexor of the arm at the shoulder, so going this way. The nerve is the musculocutaneous nerve. So there's a muscle around your elbow called the anconeus. The origin is the lateral epicondyle of the humerus. The insertion is the lateral aspect of the olecranon process. The action is it abducts during the forearm pronation, so that's going this way. And the nerve is the radial nerve. This muscle here is called the brachioradialis. The origin is the lateral supracondylar ridge at the distal end of the humerus, so that's be down here. The insertion is the base of the styloid process of the radius. The action is that it stabilizes the elbow during rapid flexion and extension, and the nerve is the radial nerve. This muscle here is the extensor carpi radialis longus. The origin is the lateral supracondylar ridge of the humerus. The insertion is the base of the second metacarpal. The action is it extends the wrist, and the nerve is the radial nerve. This muscle here is called the extensor digitorum. The origin is the lateral epicondyle of the humerus. The insertion is by 4 tendons into the extensor expansor. The action is the prime mover and finger extension, so going like this. The nerve is the posterior interosseous nerve. This muscle here is the abductor pollicis longus. The origin is the posterior surface of the radius and the ulna. The insertion is the base of the first metacarpal and the trapezium. The action is that it abducts the hand and the thumb. This is
the pronatal teres. The origin is in the epicondyle of the humerus. The action, pronates the forearm, is in the median nerve, and the insertion is in the common tendon into the lateral radius in the midshaft. Here is the flexor carpi radius. The origin is in the epicondyle of the humerus. The action is to flex the wrist. It's powerful. The insertion is in the base of the second and third metacarpals anterior, and then the nerve is in the median nerve. Nervus longus. The origin is in the epicondyle of the humerus, is in the median nerve. The insertion is in the palmar opponus, and it's like in the palm of your skin. And the action is weak wrist. I don't really know. Just a weak, yeah. The action is weak wrist. I don't really know. Just a weak, yeah. Here is the flexor carpi ulnis. The origin is also in the median, the epicondyle of the humerus. The insertion is in the base of the fifth metacarpal, and the nerve is in the ulnar nerve. And for the action, it's a powerful wrist. It abducts the hands and helps you extend your fingers during the finger extension. This muscle here is the sartorius. The origin is the interior of the superior of the iliac spine. The insertion is the medial aspect of the proximal tibia. The action, it flexes, abducts, helps bend the knee, and is in the femoral nerve. This muscle here is the tensor fascia lata. The origin is in the interior of the iliac crest. The insertion is the iliotracheal tract. In the action, it flexes and abducts the thigh, and it also rotates the thigh medial. And it's in the nerve is in the superior gluteal nerve. This is the rectus femoris. The insertion is in the patellum ligament. The action is it extends the knee and flexes the thigh and the hip. The nerve is in the femoral nerve, and the origin is in the anterior inferior iliac spine in the superior margin of the acutium. Here is the vastus lateralis. Is in the insertion is in the patella ligament. The origin is in the greater trochanter, and in the intratrochanter line of spirit. The action, it also extends the knee, and it stabilizes the knee. And it's in the femoral nerve. Now here is the vastus medialis. The origin is in the patella ligament. The origin is in the line of the spirit and in the introchanter line. And the action is to extend the knee as well, and it stabilizes the patellum, which is that small one in the middle, and it's in the femoral nerve as well. Here's the iliac psoas. This is in the insertion is in the introchanter of the femur. The origin is in the transverse of L1 and L5. Also the disc between T12 and L5. The action, it flexes the hip. Yeah, I don't know how you flex. So the nerve branches from L1 through L3. Here's the pectinus. The origin is in the pectineal line of the pubis. The insertion is in the inferior. The inferior from the lesser trochanter line of the line of Expera. The action, it abducts, flexes, and medially rotates the thigh, medially. The nerve is in the femoral and the arbitrator nerve. The next muscle is the adductor longus. The origin is in the pubic, near the pubic symphysis. The insertion is in the line aspera. The action, it abducts, flexes, and medially rotates the thigh. And the nerve is in the anterior division of the arbitrator nerve. The next muscle is the gracilis, which is this thin muscle here. The origin is in the inferior of the ramus and in the body of the pubis. The insertion is in the medial surface of the tibial shaft. The action, it abducts the thigh and it flexes, medially rotates the leg as walking. And then the nerve is in the arbitrator nerve. This next muscle is the adductor magnus, which is here. The origin is in the ischial and the pubic ramus and the ischial tuberosity. The insertion is in the line aspera. The actions is to abduct and immediately rotate the thigh, but on the anterior part. And the nerve is in the arbitrator nerve. Here we have the gluteus maximus. The origin is in the dorsal ilium, in the sacrum, and the coccyx. The insertion is the gluteal tuberosity. The nerve is the inferior gluteal nerve, and the action is inactive while you stand, but it laterally rotates and abducts the thigh. And is the majority of the extension of the thigh. Is the gluteus minimus. The origin is in the lateral surface of the ilium between the anterior and posterior of the gluteal lines. The insertion is a via short tendon into a lateral aspect of the greater trochanter. The action, it abducts the thigh. Anterior part rotates the hip medially, and then in the posterior, it rotates the hip laterally. And then the nerve is in the superior of the gluteal nerve. The next muscle is the piriformis, which is a small piece right here. The origin is in the anterolateral of the sacrum, which is opposite of the greater sacral nerve. The insertion is in the superior border of the greater trochanter of the femur. The action, it rotates extended thigh laterally. And the nerve is S1 and S5 and is L5. The gemellus, the superior, and the gemellus inferior. The gemellus superior is in the ischial spine. The gemellus inferior is in the ischial tuberosity. The actions are they rotates and extends the thigh laterally. The insertion is in the greater trochanter of the femur, and the nerve is in the L5 and the S1, both. This muscle here is the arbitrator internus. The origin is in the inner surface of the arbitrator membrane. The insertion is in the greater trochanter in front of the piriformis. The action, it also rotates, extends the thigh laterally. The nerve is in L5 and S1. Is the quadratus femoris, which is this here. The origin is in the ischial tuberosity. The insertion is in the introchanter crest of the femur. The action, It rotates the thigh laterally and it stabilizes the hip joint. The nerve is in L5 and S1. This is the bicep femoris. The origin is in the ischium tuberosity. The insertion is in the common tendon into the head of the fibula and the lateral condyle of the tibia. The action, it extends the thigh and flexes the knee. Laterally rotates the leg when knee is flexed. And the nerve is in the saccatic nerve. This muscle here is the semitendinosus. The origin is in the ischiotuberosity. The insertion is the medial aspect of the upper tibial shaft. The action, it extends the thigh and flexes the knee, and the nerve is in the saccatic nerve. The semimembranous is right here. The origin is in the ischiotuberosity. The insertion is in the medial condyle of the tibia. The action, it also extends the thigh and flexes the knee, medially rotates the leg, and is also in the saccatic nerve. This muscle here is a tibialis anterior. The origin is in the lateral condyle in the upper 2/3 of the tibial shaft. The insertion is by the tendon into the interior surface of the medial conform within the first metatarsal. The action is the prime mover of the dorsiflexion, and it exerts the foot. And then the nerve is in the deep fibular nerve. The next muscle is the gastrocnemius. The origin is two heads from the medial and lateral condyles of the femur. The insertion is the posterior calcaneus via the canal tendon. The action is the plantar's foot flexes the foot when the knee is extended, and it flexes the knee when the foot is dorsiflexed, and the nerve is in the tibial nerve. Next muscle is the soleus. The origin is in the superior of the tibia. The insertion is the posterior of the calcaneus. The action, it is the plantar of the flexors of the foot, important to locomotion, and the nerve is the tibial nerve. Next muscle is the fibularis longus. It's this muscle. The origin is the head and upper portion of the lateral fibula. The insertion is the long tendon underfoot into the first metatarsal and the medial cuneiform. The action, it planars flexes and exerts the foot and may help knee and keep the foot flat on the ground. And then the nerve is the superficial fibular nerve.